Thank you, Mr. Vice President. I think you heard very clearly our concern in the New York, New Jersey metro areas. This also includes Connecticut and Long Island. As we talked about, we did see a significant increase in Sussex County over the weekend. The weekend numbers are always difficult. I want to be clear on that because sometimes case reporting is not as accurate over the weekend. So we'll be watching very closely today's numbers and Tuesday's numbers. We're also very, of course, focused on the New Orleans metro area, and that includes the 3 parishes of Jefferson, St. John's the Baptist, and New Orleans proper, and of course the Detroit area, which is Oakland and Wayne. As we mentioned before, we're continuing to track very closely out of concerns of it potentially reaching logarithmic phase in the Chicago metro area, the Boston metro area, the DC and Baltimore metro area, Indianapolis, the Denver area, and 2 regions of Pennsylvania, Philadelphia, and the Pittsburgh area, as well as Dallas and Houston in the Texas area. I had a very encouraging call because we also don't want to miss anything. Remember, I showed you a lot of states were very much under 25 and 50 cases per 100,000. There were a few standouts that we were concerned about, which was Vermont, New Hampshire, Idaho, and Montana. We had excellent calls today with their health commissioners, and they're they're on top of the situation. These were micro outbreaks that occurred due to ski events and weddings and nursing homes, and they were able to describe in critical detail the incidents and how they're tracking and tracing. So they are still doing full contact tracing through those areas, and I just want to applaud both a rural and metro problem, and I really want to applaud how many of the states that may have smaller populations are approaching this. That gives us encouragement of how we can talk about beginning surveillance activities at the same time we're following these very clear outbreaks and ensuring that there's full supplies based on the very granular data that we're utilizing. And I just want to thank the mayors and governors who get us that granular data and allows us to make these deep interpretations across all of the United States. We know each governor is concerned about their areas, but these metro areas cover different areas. So the Philadelphia area also includes southern New Jersey and Delaware, and so we have to really look at things very much as both the metro and the communities that surround those metros. And so all of those people, we ask you again throughout the United States to follow these very clear guidance. I want to just recognize both HHS, and you heard about the work that Admiral Giroir is doing, the work that Dr. Hahn and Administrator Seema Verma are doing, and also Administrator Engels in the work of HRSA to really ensure that our federally funded clinics are actively engaged in all of these aspects. But I also want to recognize the military, the medical corps, the nursing corps, and the medical subspecialty corps. These were my brothers and sisters for 29 years. It is highly unusual for the active force to be called into a domestic situation. I think that shows you how seriously we're taking this at the federal government level. In my 29 years in the military, I was never deployed domestically. So this is showing you how serious of an event we take this. If the military is deploying domestically, it is another reason for every American to be following these guidelines. Finally, CDC quietly launched a new website. It's you go to cdc.gov and you go to COVID-19, you can find their surveillance data. This surveillance data is bringing together our influenza-like illnesses with their syndromic management databases so that you can track the respiratory disease across the United States. The states are used to using this system. It's in emergency rooms, it's in hospitals, it's in doctors' offices, and it gives you insight, and you can see very clearly influenza A peak. You can see the influenza B peak, and now you can start to see the respiratory disease from this current outbreak. These are the systems that exist within the United States that will be strengthened in order for us to do comprehensive surveillance. So I just want to assure the American people, while we're working on these outbreaks, we're also working on bringing new systems together that have a comprehensive look across the country, building on the strong work of CDC as a public health institution, so that we can work county by county, community by community, state by state, to really understand where this virus is and where it will be, but also as an early alert for us in the future. So I just want to assure the American people that as we're working on the crisis of today, we're looking to the future to ensure we have the systems in place to bring those early alert systems together while we work on the antibody testing and while we work on continuing spreading and increasing the diagnostic capabilities that you see presented here. Thank you.